Welcome back and good morning, Central Oregon. Dr. Gary Frei joins me this morning from Ben Memorial Clinic. Good morning.
Good morning.
So we're talking this morning about thyroid and thyroid issues. First of all, what are your thyroids and where are they?
The thyroid is a endocrine gland that's positioned in the center of the neck, and its sole job is to make a hormone that basically sets the pace of our body's machinery, how hard the cells work and so forth. So without this hormone, the body slows down over a long period of time. You would even die if you did not have thyroid hormone. And on the other side, if it makes too much hormone, the body machinery runs too fast. Patients lose weight and can become ill for that reason as well.
So thyroid nodules then, what are those and the frequency of those?
Yeah. Basically, this is a growth or a nodule within the thyroid gland, which is normally fairly uniform. In the past, most nodules were discovered by palpation. Either the patient felt or saw the nodule, or maybe their physician saw the nodule. At that time, the nodules were thought to be fairly infrequent. And in fact, if you had a nodule found at that time, say 20 years ago, that thyroid was likely to be removed by a surgeon to make sure the nodule was not a cancer. With modern imaging like ultrasound and CT scan and MRI, a lot of these things that are being done in this region, we now know that thyroid nodules are incredibly frequent. More than 50% of us will have a nodule by the time we're 50 or 60 years of age. So now you have this huge number of thyroid nodules that are being discovered, and it's not really practical to remove them all. There would be a lot of patients having surgery, much of it unnecessary. So now we have to decide which of these nodules might be worrisome or bad, that is a cancer, or which ones can be watched. And the way we do that is with ultrasound. A good ultrasonographer can characterize a nodule, give you an idea if it's likely to be worrisome. And certainly if there's any signs that it's worrisome, they can use the ultrasound to put a needle into the nodule, extract cells from the nodule, and a pathologist can then tell us whether it might be worrisome or not. Yeah.
What kind of a percentage do you say there would be between nodules that are not worrisome and then those that eventually turn out to be something more?
They're very common, and fortunately, more than 80% of the nodules will be benign or will be non-cancerous. But that leaves about 15 to 20% that will look abnormal and will need to have a biopsy, potentially might have to have surgery to solve that problem.
Is it safe to say, because you mentioned that now because of the modern imaging techniques, you know that nodules are much more frequent than you had first thought. Is it safe to say that that's because of the modern imaging techniques, and this is not just a more frequent occurrence now of thyroid nodules?
That's a very good question. It is in large part related to the imaging and the availability of the imaging and the variety of studies that will show a thyroid nodule. But it's also felt that nodules are becoming more frequent. They are more frequent in women than men for reasons that we really don't know. But a lot of it is related to the frequency with which people are having tests on this area.
A lot of women I know, we were talking about this before we came on, so many women I know, some of the symptoms of having thyroid issues are, a hair loss or thinning, fatigue, depression, a weight gain. Well, any woman I know could have any number of those. So what are the real hard and fast symptoms of having thyroid issues, and when should we see a doctor?
Well, a lot of if your thyroid were not to make enough hormone and your body was then slowing down, the symptoms are very common symptoms that almost anyone can experience at points in their life. But they're generally things like excessive fatigue, some weight gain, just not feeling well, not having enough energy, You know, sometimes their hair does not seem normal. The hair is fragile. So those are the common things. And I think at this point, many patients will have had their thyroid functions checked. Thyroid functions is a blood test that allows the physician to determine, is the thyroid working on a normal pace, or is it working too slowly or too much, for example.
So that's something when you're dealing with your general practitioner that they should be just testing as a matter of course. But if you haven't been tested and you think or suspect that there may even be an issue, please get tested and talk to your doctor about that. You can also call them at Ben Memorial Clinic at 541-382-2811 and then benmemorialclinic.com. So it was really nice to see you this morning.
Thank you.
Thank you.
Appreciate it.